nails, Jack.
Paint me like one of your French models.
God!
Right?
Why did I mess it up?
I'll never let you go, Jack, until I do.
What is happening, people, and welcome to today's video where we have back this very special guest, Dr. Gregg Inocensio. Now, if you guys don't recognize Gregg, we've been friends for the better part of a decade. We've been very good training partners. We've been very great competitors against each other. This guy is an amazing physical therapist who also deadlifts 900 pounds and is an active strongman competitor. So none of his knowledge that he's going to share with you is theoretical. Today, we're going to talk about pain, and he knows all about it. So, Dr. Gregg, what are we talking about today?
We're going to talk about some knee issues. From the shoulder video, you guys were, kind of talking about hip and knee and stuff like that. So we're going to talk about two, what I would like to believe, common knee injuries that we see in strongman or any kind of training. It's not anything super acute, like, oh no, I tore my whatever. No, this is something that comes on gradual, then it hits, then you're kind of like, how'd that happen? So we're going to go over just general anterior knee pain, whether that's kind of quad tendonitis, quadricep tendonitis, or patellar tendonitis, and distal IT band syndrome. That's usually on the outside lateral portion of your knee.
Terrific. So hopefully this will help a ton of you out, and we're going to jump into it right now.
All right, so here we have Brian's knee. He is not symptomatic, so fortunately he doesn't have any knee pain, but I know a lot of people watching do. So we're gonna kind of go over some sort of things like anatomy for the anterior knee. So we have the quadriceps, right? Vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. Four things for the quadriceps. They come down into the quadricep tendon, and a lot of folks will have pain anterior knee, but at the top of the knee. Then the tendon then wraps around the patella, comes to the bottom of it. You have the patellar tendon that goes from the inferior pole of the patella all the way to the tibial tuberosity, or that bony part at the top of the shin that really hurts when you run into a coffee table. So typically what happens with tendon issues or anterior knee, if we're talking about the quad tendon or the patellar tendon, we're looking at load tolerance issues. Either something is really strong, like the muscle, like the quadricep is so strong and it got strong really fast, and those tendons just haven't had the time to adjust to that strain that the muscle's pulling on it. It can lead to some tendonitis or tendinopathy, tendon issues. Whether it's the load of, for example, like running, like sprinting or jumping or Olympic weightlifting, where there's a very large plyometric force, and then the tendon has to eccentrically load right at that knee joint, and it's just not ready for it. You get an inflammatory process, and then you get diffuse kind of anterior knee pain. So that's what usually happens. It happens over the course of time. It's not an acute injury. It's not like, oh no, I twisted my knee. This is something that it's like, oh, I feel this coming, but I still can lift. And then it gets to a point where a month or so later, you're like, no, this is really starting to impede my training. All right, so then we're going to talk about the distal IT band. So I'm going to have you quarter turn for me. So we're talking about right here. So at the flex knee, we can kind of really see Brian's developed. I'm jealous of your hamstring, but we're gonna straighten out this knee a little bit.
You're welcome, everyone.
Yeah, you're welcome. Sorry, children. So your IT band goes from the top of your hip, starts at the lateral aspect, ASIS, and right around the iliac crest, goes down the side of the thigh, all the way down to the side of the knee, wraps around to the front, and then attaches at Gerdy's tubercle, or the lateral aspect of the tibial tuberosity. Typically, if we're having distal IT band issues, you're going to feel pain right at the lateral knee, right above maybe where the LCL would be. So if this is the joint line, usually you're feeling it right about here. Typically, you'll feel this when you're going into a squat and it feels like this weird impending pressure, like your knee is going to give out. And then once you get to a certain depth, it feels like your knees gave out. I've had this issue myself. Typically what happens is that this IT band gets really tight. There's a bursa, a fluid-filled sac underneath where this IT band is. Then you get friction, that bursa is innervated, you feel this really sharp pain, and that's what that sensation is. No one really knows why you get distal IT band pain or what it causes, but it does happen. And there are some exercises that we'll go over today that help with that. All right, so first we're gonna do a whole bunch of stuff for hip activation exercises, and then some hip mobility things. and then exercises for specifically for the front of the knee, you know, those quad tendon and patellar tendon issues, and then for the distal IT band issue. Why the hip? So the majority of the issues that occur at the knee are a function of hip issues, whether it's immobility, hip weakness, hip stability, things like that. The muscles that actually act at the knee, cross the knee, things like that, actually start at the hip and then cross the knee and then act at the knee. The majority of knee issues are actually, a function of hip dysfunction. Occasionally there are foot-ankle issues that cause pain in the knee, like for example, when you're squatting, you need a certain amount of available dorsiflexion to make sure that you can stay rooted to the ground, keep your heel down and squat and provide that, pressure through your foot, a stable foot, to then come back up out of a squat. There are certain things in terms of rooting, there are certain things in terms of tibial rotation that are needed for squatting, running, propulsion, things like that in terms of the ankle, but the majority of the issues that occur at the knee are a function of hip issues. So we'll go into that next. All right, so the first thing we're gonna go over is a hip circle. This is just a very easy introductory warm-up exercise that we can do for the hip. Warm up specifically glute med, glute max. Get a very little stretch of the hip adductors, your groin muscles. So what Brian's gonna do is just to come out, abduct like a fire hydrant, extend the leg and the hip, and then come back around, and then that's 1 rep. We're gonna do a set of 15. He's gonna do 15, but he doesn't have to show all 15, but I would recommend 15, 20, 2 or 3 sets. All right, next, we're gonna go into some fire hydrants. The band that we have here is the Cerberus Grip Halo. Use code NEVERSAVE, save 10% on your order at CerberusStrengthUSA.com.
That's very good. That's better than I did.
That's right. So then we're here, we're gonna start in quadruped just like with the hip circles. We're here, the band is around the knees, keeping the back flat, and without using pelvis or a low back, lumbar spine substitution, Brian's just gonna go into hip abduction out the side, fire hydrant, like he's a dog trying to piss on a fire hydrant. We're gonna do a set of 20. We're looking at 2 or 3 sets of 20 for this exercise. You should feel this in the side of your hip, kind of the side of the butt cheek. If it burns, you're doing it right. If it's painful, you may be not doing it right. If you feel it kind of at the top of the hip or the front of the hip, you're not doing it right. We're looking for a flat spine, pure abduction, peeing on a fire hydrant. All right, so next we have a nice, easy 90-90 internal and external rotation stretch for the hips. So the way Brian is right now, we are in external rotation of the left leg. We are in internal rotation of the right leg or the rear leg. He's going to aim kind of for the front foot, kind of splitting 50-50 to get a stretch in both hips. Hold for about 5 to 10 seconds, and then he's gonna switch sides. Bring that in, aim for that middle, and then feeling that stretch. Hold again, 5 to 10 seconds. We're gonna do probably about 5 on each side. All right, so next we have a hip shift. This is a really good exercise for glute med activation, a little bit of hip external rotation, and to stretch out your hip adductors or your groin muscles. So we're here, hips are kind of square, or as square as we can be to the camera. We have brought this hip out as much into external rotation and not, out to the side as possible. The knee is in line with the second toe, give or take. We're kicking in that glute med to actively externally rotate and abduct this knee or this hip, and then Brian's going to keep his hips facing the camera and then just shift towards his knee towards his foot, keeping the knee over the toe. As he shifts laterally, he should feel a really good stretch in his groin, and he should feel the side of his butt kicking in, otherwise his glute medius, activating to keep active external rotation and abduction of the hip. All right, so last but not least, we have a lateral distraction of the hip with a band. Now, you've probably seen this done, but we'll go over kind of the nitty-gritty. You want a band of pretty decent strength. You'll know it by being able to feel a little bit of a pull in the hip when you try it, but whatever band you decide to use, we're anchored about hip height when you're in half kneeling. This band has to be anchored on you high into the groin or high into the grundle area. So If it's a little bit lower on the thigh, you'll just feel a pinching sensation in your thigh when you do this. It's got to be kind of in that groin crease. Close to the sensitive areas, but not on the sensitive areas. No. But what we're in tall kneeling. With the lateral distraction, we're just going to lean forward. We'll go into a little bit of hip flexion. We can rock back and forth here. Or if you want to, you can even sit up tall or kneel up tall and then push this into internal rotation. You'll feel that kind of pull at the hip a little bit.
Yeah.
Theoretically, what we're doing is lateral distraction, stretching the hip joint capsule laterally. If we do this, it's the best bang for the buck for a hip capsule stretch. That will theoretically allow for freer motion for hip flexion, abduction, and extension. All things that we kind of need in an athletic exercise or performance event. All right, so next we have some exercises that you can do for if you just have some general diffuse anterior front of the knee pain. So what we have here set up is we have some bands set up. Brian's sitting on a bench. We have some bands set up about the same height as his ankle. We want a lot of band tension here so that when he kicks out, you get maximum band tension around 90 to 80 degrees of knee flexion. He's going to kick out. Hold that. If you can go past this, the band is too weak. You want like a maximum 1 RM kind of band strength. But we're doing it at about 80 to 90 degrees of knee flexion. We're going to hold this for about 20 to 30 seconds, and we're going to do this 5 times. All right, so next we have something that we can do for quadruped, similar to what we just did with an isometric. This one's in quadruped. We have an Elite FTS Monster Mini Band wrapped around Brian's hand, around his waist, going back to his other hand to provide resistance at the waist. So Brian's going to get into a quadruped position with his knees up. So you want to pick whatever knee angle, flexed or extended. You extend the knee right before you would initially feel pain. Stop just short. Hold this position. Make sure that you're feeling the quadricep activate. You're feeling some pressure, a little bit of pressure at the quad or patellar tendon is okay. You hold this position for 20 seconds. I want you to do it for me 10 times. We have bands to add resistance, downward resistance through the waist. You can also do this single leg if double leg is too easy. So we're here, and you hold that. Look at that, look at that. Yeah. All right, so what we have now is a step up with a band. The band is at about just below Brian's knee height. This is about a 12-inch step. The band is trying to give a valgus or an adduction force at the knee. Brian's going to have to use his hip or his butt muscles to keep the knee in line with the foot. So our starting position is knee in line with the second toe or the second metatarsal. We're using that as a landmark. He's going to step up while maintaining that knee in line with the toe. The glute medius, which is important for hip stability and knee health, it has to kick in the entire way from about 90 degrees of hip flexion all the way to full hip extension. We're going to do about 3 sets of 12 on this, both legs. Next, we have a lateral step down. This is really good for anyone with some distal IT band syndrome. We're here, we want to make sure that the hips are level. They're not tilted up or down. They're parallel with the ground. We are here on a 4 to 6 inch step. These two bumper plates, it's about a 6-inch step. The off foot, Brian's right foot is dorsiflexed. Brian's going to step down, keeping the knee in line with about the second toe, heel touching as soft as possible. As you're stepping down, try and make contact. Don't break any eggs, per se. If this is symptomatic, you feel pressure in the side of the knee or whatever the case may be, lower the height. Work at a 4-inch height, 3-inch height, whatever that you can do. Hold at the top for about a second or two. We're going to do a set of 15, 3 by 15. So last but not least, we have a side plank clam. So Brian is set up like you would normally do with a clam. As he comes up, he is going to abduct or lift the top leg so that the only thing supporting him on the bottom is through the elbow and only through the bottom foot. Okay, so as he comes up, holds at the top for a second or two and then back down. You want to do this on both sides because you're getting a nice isometric hold on the bottom, and you're getting your isotonic, concentric, eccentric on the top. We're looking for sets of 15 or 20, probably 3 times both sides.
Brutal. Brutal.
Harder than it looks. If this is too hard, then he'll bend the knees, keep the hips extended, and then as he comes up basing through the knee, he'll lift the knee up like that. If this is too easy but the other way is too hard, you put a band in between the knees. This is a personal favorite exercise of mine. Brutal. All right, so these are some exercises, some general exercises, general stretches, things like that you can do to help improve knee health. Now, if you're thinking to yourself, well, it doesn't hurt when I squat or it doesn't hurt when I do this, that's okay. You know, not everything is technique. I know that's almost very Pandora box thing to say, but technique is very important, but it's not everything. When you see someone squat, you know, from what is very popular in terms of bro science and things like that, someone's squat may look ugly as sin or something along those lines. But if that person is asymptomatic and their body has adapted to that specific technique that works for them, then that's okay. You don't have to be like, hey bro, like you need to do these. If they are asymptomatic, there's no pain and they're still progressing, then it's all good. These are some exercises that if you're having those symptoms of knee pain that you could throw in as prehab, your warm up, or something to do afterwards on your cool down that can help with pain over time.
So if you guys have had any knee pain or shoulder pain, make sure you check out either this video or the last video and just go over it again, try different things, see what works out, because everything that he showed me from the last shoulder video has worked out for me and I'm back to pressing and feeling great. So I just thank you so much for taking the time and just the energy and the effort and everything you do when you come here. So guys, I hope this helped some of you out. We had a good time. Hope you guys had a good time. We will catch up with you. If you guys have some other things you'd like us to cover in the physical therapy type of spectrum and umbrella, then please let us know in the comment section down below. But we thank you so much for everything. I will catch up with you later in the week. Until I do, go out something amazing, guys. Keep working on it, people. Be nice to each other. Look at these traps. These traps just
the
saucy.
Perfect traps.
Beautiful.